What a great question. One of my followers, and I appreciate every one of you guys, but some are really picking up a lot of tips from me. And please share, and I'm not going to say the rest. Just make sure you're supporting me. I do not need to know your details. I just want to know that you're learning. And the best way to do that is obviously pressing the like button, because it is not as easy as it looks. So let's try to get started on how cleaning all your equipments that you may have at home, because obviously cleaning them is so important. This video is to answer my follower about how to clean the nebulizer, and whether another part that she asked, beautiful questions by the way, was the skinny tube, this one. This that fits right in here, and it fits on your machine. You see that? But once you're done, you shut off, of course, your machine, and you disconnect the tubing from the device. And now you have this. And I have to say, which part is important to clean? And I really believe, because it's happened to me once before, I believe this tubing should come off first, and this, you don't need to wash this. I repeat it. If you want, you can buy a new one, exchange it, but I would highly recommend you don't put water in here. When you do that, when you connect it in, it's not going to work. It's not going to bring out a mist. So please, again, a hint, don't wash the skinny tube. Set that aside, okay, with your other equipments. I'm going to talk about this one later on today, hence the purple. But I want to make you guys understand that setup, we have to be fast, because you guys keep, again, going like this. I want you to come back down and watch me. So it's going to have to be it's going to be short because of this business where I want you to come back down, watch me in a few seconds, and I have to teach you all this stuff in a few seconds, and that's tough. The easy part is picking which makeup I'm going to wear. The hard part is keeping you guys learning and appreciating me, because it's a lot. I appreciate you. You need to appreciate me. Press the like. I hate to say that, but I think it helps me get motivated, and the questions definitely come in a variety of ways. They come in the DM, which is okay, as long as it's strictly professional questions and kindness. And then please don't promote anything on my site, because I don't like that. And I'm not here to promote anything other than promoting your elevated knowledge, your insight, improving the insight. That's all I'm here to do. And then hopefully you become my patient, then it's super easy to take care of you. I'll take care of you in seconds. Anyways, getting off all that, I had to do it because I realized I'm the only one who's not doing it. And maybe that's why nobody's following and nobody's shipping me out to a loved one out there who needs all this help. Okay, going back. This nebulizer is with liquid inside. We're going to disconnect this. And I would say disconnect it right there and keep it, don't move it around. Disconnect it and throw it out. Get it all out, all the water out of here, okay? Because when you're putting it in, also you're putting it on the sides. You're not trying to put water in that center part. That's only for pressure to come into your nebulizer and push out the mist. So please don't put water in here, because it has happened to me before in my machine. The whole thing, I had to throw it away. And I know you guys are trying to save money. So let's not make this video too long. Just make sure you turn it around. It's a twist here. Throw out. Make sure it's completely, emptied. Okay? And you can wash this part, and you can wash this part. Wash it all out, but I would highly recommend you keep it as dry as possible when you're going to reconnect the whole thing, because if it has water in here and the water gets into this tubing here, I don't think it works. It's happened to me before, and then I saw water and then it didn't work. So I may be paranoid, it may just be me, but you can always look it up for yourself. That's what I do to clean my device and what I tell my patients to do. If you know better, just write me a comment about it, okay? Now, these things can be washed in a dishwasher as well. We're gonna take everything apart and we're going to wash these, okay? You put them in the water. I think is, I prefer the dishwashing liquid. And that's because it's a safer chemical. We're eating it, it's safer. Please do not go and buy bleach. Please don't go and start taking all these wipes with Clorox and God knows what else because you want to kill off the bugs. I get that. But hot, warm water, you put them in, don't melt them, it should work. Just a little bit, guys. Antibacterial. This is just an antibacterial soap. Dishwashing, of course. I don't like to do all this stuff in the kitchen, but you can do wherever you choose. And here we have water. And we just wash them. I would just, put it in, run some water, and, make sure the water is soapy, see mine, it's gotten a little soapy. And I mean, if you are getting over like a cold, like you're sick, you don't want to reinfect yourself. This is all yours. So you clean it off, you take it apart, all the parts. Don't go crazy, but just make sure, once, maybe every 2 days or every other day or whenever you can remember, just to allow it to dry as well in between, right? And get all the mucus that may have gone in there, and the moisture that may have been sitting there. You don't want it to sit there for a long period of time and, become another petri dish. Because, we're trying to get rid of the petri dish in your lungs so that you don't get infected over and over again. Okay, so we are expectorating. We are getting rid of the phlegm. Okay, so I want to say to you that once all this is done, right, you rinse it off over and over again, right? You make sure that you get all the soap residue off of your device, okay? We definitely don't think that's a good idea for you to inhale, which is again the reason that I would use like this safe option, which is your dishwashing liquid, which everybody should have in their homes. I don't think it's the dishwasher, stuff that you should use, but you could, and I'm going to show you at the end, you could end it all and just put it in the dishwasher. Put all these things in the dishwasher and they can kind of wash with steam. That's a good idea, but I kind of think that's sort of nasty, right? Because hopefully you're using, I'm a little paranoid. You're using the dishwasher for everybody. You shouldn't really put that in there, but do what you please. Nobody will know, okay? So we would put all these things and leave them somewhere to dry. I wouldn't put them in here. I would put them somewhere where it's clean, sterile, to dry, to completely dry. And that way, you absolutely not using a towel, okay? Absolutely don't use a towel. Take your already rinsed over and over again, right? Product, parts, you can rinse really well, get all the crevices, and take it where it could dry, or you can put it in the dishwasher, whichever one you want to do. Definitely do that. But again, I'm going to remind you guys that this definitely, I would not advise washing this, because after all, the machine is pumping one direction that way. So we don't need to do all that. But if you are saying, well, I can't do that, and you can afford it, you can just keep buying new ones. I would not recommend that. For my patients, I have to give them this on their way out because we're not reusing them. For you, however, you can definitely reuse it. And if your tubing is working mechanically, sweetheart, because you asked me that question, if it's still working and it's giving you the mist, it works. You're good. You can use it. So I'm just going to show you guys the drying and putting it in the dishwasher. If you choose that option, you can even, I wouldn't recommend leaving it in the dishwasher. Once the dishwasher is over, take it out and air dry it, because we don't want that mist and residue to stay inside and make another reservoir for other bugs to sit on top of it. I would not use alcohol, okay? I would wash it. I would definitely not use very hot water. Lukewarm is fine. I would definitely use like a dishwashing liquid. Not like definitely dishwashing liquid, because we don't want to use detergent and something that has corrosive agents on there and then inhale and cause a problem. The more odorless, the better. The more neutral, the better. And air dry is safer. I think it's safer to air dry it. You don't need to blow dry it. Your nebulizer pretty frequently because you're sick. I would clear, majority of that illness and then decontaminate. Or let's say you got COVID, I would just basically get a new one after that illness. As soon as you know you're over with, get a new one. It's worth it, because I think you may start thinking, paranoia may say, well, I think I'm sick now and I'm reinfecting myself, and there goes another call to Dr. McConnell. You don't need to. So I think you're not sharing it with anybody. You shouldn't, because we are all contaminated with whatever grows there naturally, and when we get sick with whatever we are sick from. So I would recommend that this is for you. Your name, put your name on it if it's multiple family members having it. Don't share your kids with yours, and vice versa. Air dry it. And I'm going to now go into showing you guys how to air dry it. I don't think I need to show you that, but I will show you that. You can do this as an option, okay? Make sure when you air dry this, I would really make sure this is dry, and make sure that this doesn't have any water residue, because that may be the reason your device won't work, okay? And then you can reconnect it like I've showed you in my other videos, how to connect a nebulizer machine. If you have questions, please don't hesitate to ask them on the trail. And please, if it's more comfortable for you, you don't have to share all your information. You can also DM me. The best thing here is to learn, and obviously when it all falls apart and you don't know, you don't want to listen to the whole thing, just read the instructions. There's instructions in there too. Be very safe, and I hope this elevated your knowledge in one way or shape or form. And if it did, please give it a like. And if you have anybody else who suffers from chronic illness such as asthma, COPD, send them my way and share my video. I wish you all the best, and I can't wait to show you guys how to, and if you want to know how to use it, what is that device for, how to clean it, please make sure you save me and watch out for those videos. I wish you all the best.